Authorities in Sierra Leone, the highest hit by the outbreak, are not taking chances. Security forces in the country have enforced a quarantine on all centers of the disease to help health workers and aid workers to work unhindered.
We've also established a treatment center in Laka, and we are currently in the process of staffing that center. As a matter of fact, we have some of our young doctors and nurses who were in Kenema for training. These young doctors and nurses are expected to work at that treatment center at Laka, in addition to the international staff that we expect in country starting tomorrow.
In Liberia, universities in the capital Monrovia were shut on Thursday, a day after the government announced closure of all schools across the country to halt possible spread of the deadly virus. The government has also announced the quarantine of a number of communities. These new measures came as the World Health Organization announced it would launch an action plan to combat the disease.
We talk about around $100 million being needed to fund this response plan. The plan includes, identifies a whole range of medical personnel required to help support the response to the outbreak. This includes doctors, nurses, logisticians, epidemiologists, etc., communications experts, social mobilization experts to talk with members of the community to get the messages out about what to do, about to present at health facilities, about to ensure that they get there early for treatment.
Meanwhile, a U.S. humanitarian aid worker who was infected with Ebola in West Africa will be transferred back to the United States and treated in a special high-security ward at Emory University Hospital in Atlanta. So far, 729 have died from the virus in West Africa. The leap in the number of cases and death toll has raised international concern and placed health facilities in the region under great strain. Susan Mwongeli, CCTV.